Hi, I'm Dr. Julie Steinauer. Let's talk about something really interesting today. You probably never expected me to talk about your teeth and your vision, but let's jump right in and talk about those things. So we're going to talk about the movement of your jaw forwards and back, that temporomandibular joint, how it can affect your vision, maybe even affect your inner ear, and maybe even affect your spine. So there's lots of stuff we're going to cover today. Now, if you're local to us and you want to connect with us, call us at 618-288-1489. If you're not local and you happen to be elsewhere in the world, you can still connect with us. Go to our website at visionforlifeworks.com and you can do one of two things. If you want to email with us and get more information, then fill out the questionnaire on that page. Now, if you happen to have watched several of my videos before, or maybe even you've been following me for a year, then you might just be ready to do something about your vision, and that button that says schedule a consultation is what you want to click on. So click on that button. It's going to take you onward to next steps on how you can schedule a consult with me. Now let's get back to talking about TMJ and vision. So what happens if you have some major orthodontia treatment and you're having to move your jaw forward or back and realign things along with realigning your teeth? Well, it actually can upset your vision, and that just has to do with this joint being connected to ligaments, tendons, nerves, and the skull itself. So all of this kind of being interconnected can have an effect on vision. And it's common for people to develop visual problems, like maybe difficulty using their two eyes together as a team. They feel like maybe they can't track as well. They might have double vision. They might actually have an onset of a strabismus or eye turn. Those things would be common. Now, there's another tricky component here where the inner ear could be kind of triggered in all of this mass movement, which could be very necessary for your, dental and orthodontia treatment. However, it can, again, trigger lots of things for you. You just need to kind of be aware of them in case you happen to experience them. So for your inner ear, you might even notice something like vertigo, where you notice things seem like they're spinning or moving, or you just feel dizzy and maybe even nauseous feeling. Other things that are really common are headaches, because if this joint is being kind of triggered or inflamed because of movement, this temporomandibular joint, there's some muscles that come down from the skull area and attach right in here to help you with chewing. And so that can cause you to get headaches, here, and sometimes it can be located in other places, but most commonly we'll see headaches kind of right in here, maybe even like a band around the head. So what are some other things? Well, there's one more component we can throw into this to make it really complex, which is to say that your cervical vertebrae or cervical spine, so C1 through C, mostly it's going to be around C4, can typically be upset if you're having a lot of movement in your jaw because, again, of some orthodontia or braces treatment. So is there hope? Can you actually do anything to correct all of this big tangled mess of stuff? Well, the answer to that is yes, we can actually provide a lot of support. Obviously, if you're having to do the orthodontia, we can't do anything about that. Maybe you just need to go through it. But there is support and things that we can do using our Syntonics light therapy goggles, which we talk a lot about, and retrain the brain how to use the two eyes together. We might even recommend that you need to have some chiropractic care to help out with your cervical vertebrae. And depending upon the severity of what's going on with the inner ear, there may be some treatment needed or necessary for vertigo or vertigo-like symptoms. So there's, as you can see, kind of a tangled mess of stuff that can go on. When we're talking about moving the whole jaw around and realigning the teeth, and how the temporomandibular joint can affect vision, can affect the cervical spine and inner ear, it's all interconnected, or it can be. So if you have further questions, certainly you would want to contact us if you're local. Again, call us at 618-288-1489. If you're not local, you can go to our website, and there's two choices. Once again, you can fill out either the questionnaire, or what you can do is click on the schedule a consultation button. That's going to take you direct to scheduling a consultation to talk about how we can help you. And with that, I'm going to say thanks for tuning in. If you like this video, like it, share it with your friends, subscribe to our YouTube channel. Thank you.